It infuriates me that people don't have access to health care in Colorado. It infuriates me when I get a phone call and a person is telling me that they've applied for health insurance and they can't get it, and the only reason is because of their diabetes.
We're in a total crisis. We have almost 20% of our population that has no insurance or is underinsured.
Whether you have insurance, whether you're uninsured, whether you're on a public program, almost everybody I know has had some issue in accessing health care or getting paid through their health insurance program. And so really the Story Bank is collecting those stories about, did you have access? What happened? Was it a problem? Was there a barrier?
The biggest health care problem for our family, pertaining to Mark and Eric, are premature twins who are now 14 years old but have a variety of issues, cerebral palsy and so forth and so on, has to do with just the complexity of the system. It's a full-time job to navigate, and frankly, the people you encounter know a lot of information in a very narrow context. So trying to find someone who can navigate across systems borders on virtually non-existent.
It's very, very frustrating. It's frustrating because we spend enough money on health care in this country that we should be able to provide health care and access to health care for everybody, and we don't.
That's exactly what CCHI is all about. Having a broad base of members that represent a lot of different constituencies, educating them, empowering them, bringing their voice into the decision-making process, and listening to them, and sitting down in the room and finding that consensus to move forward, saying, what is it that we can all agree about? Because these are average, everyday Coloradans that are small business owners that are trying to provide insurance, or that are farmers that are trying to get insurance, or people just out of school. They're the people that really make up Colorado, and we need to find a way to provide health and health care to them.
We'll bring a voice for consumers in response to the voices of the health insurance industry, pharmaceutical companies, provider organizations. Consumers were very much left out of that voice, or their voice before CCHI was that of individual organizations or individuals who chose to speak up. Now there's much more of a united voice where all of these groups have come together, and so these issues are a concern for all of us.
What I see CCHI doing at the Capitol is providing a voice for consumers with regard to healthcare issues, and it's many healthcare issues. It's maybe Medicaid reform, or it's opening up access to healthcare.
One of the most important things about CCHI is that we're a coalition of members and partners, and they're critical to the work we do. We can't do the work without them. They not only drive sort of the direction of the work, but they're intimately involved in the work on a daily basis, and they're just the most important part of what we do.
Eric had just undergone tailbone surgery, and without CCHI's involvement in terms of promoting the funding for home health care, in terms of making some funds available for home modifications, he'd have been in the hospital for weeks, potentially, as opposed to being able to come home in a couple of days, where he's able to recover much more effectively. He's in a safe environment that he knows that's a lot more cost effective, and he's going to heal a lot more efficiently. All of that's really important from the standpoint of using public resources effectively. Nobody's out there wanting to waste. Everybody wants to make sure that the limited resources are used for as efficiently as possible.
We need people who are educated on healthcare. We need people to speak in the policy arena and the legislative arena. We need people to share their stories with us so that we have sort of not just the statistics, but the faces on the real impact of access to healthcare and the lack of access to healthcare here in Colorado.
The most important contribution that CCHI makes to the fight for access to quality and affordable health care in Colorado is really a two-pronged approach. One is a public education approach, but the other is keeping the legislature honest and responding to the need of the Colorado citizens in terms of access to health care. And without CCHI's driving force to say, we as consumers need access to quality and affordable health care, and without their success at things like Amendment 35 and being able to say, see, we were right, the voters overwhelmingly approved an additional tax which will provide health care coverage.
The healthcare system in Colorado is incredibly complex, and consumers really need help finding the doors to open the access to health care, regardless of what kind of health insurance or health care they look for.
Colorado Consumer Health Initiative is able to provide policy research and communications on different issues to us and to other organizations. It's not available anyplace else.
Our Guide to Services for the Uninsured is statewide. It's a phenomenal tool. It not only breaks down what programs might be available to somebody based on whether their age, whether or not they're a parent, different sort of categories, federal and state programs, and then it goes county by county and lists services that are available for the uninsured.
I think one of the things that CCHI has done so well is let the public in Colorado know about the status of health care in Colorado and let the public know that it's at a crisis point. I think because of that, a recent survey showed that 69% of Coloradans were willing to pay an excess tax to provide minimal health care, not health insurance, but health care for all Coloradans.
Well, it's clear that residents of Colorado are concerned about health care, that it's a priority for them, and providing donations and funding to CCHI is really about saying, yes, we need to find a solution. We need to find a solution that supports consumers, that we're going to carry people's vision and concerns forward and work on behalf of consumers.
The solution is really pretty simple.
Everyone gets health care.
Exactly.